Thank you for joining this presentation today. We're excited to present this project that is exploring the top research priorities in student mental health around the world, a Global Delphi Consensus project. So just to give you a little bit of a background on what we've done in terms of getting to the point where we're at as of today, this is a long-term project involving three main groups of people and experts involved in identifying the research priorities for student mental health. So first of all, we have a global student working group that has been intimately involved in across the research goals of this project. We also have a global consensus working group, again, experts involved across the world around student mental health. And we have an expert advisory committee that has been involved in exploring the findings and the original survey that we'll talk about leading up to the findings that we're presenting today. So combined, the Global Student Working Group, the Consensus Working Group, and the Expert Advisory Committee help us to build this global consensus project.
So Catherine and I today have the privilege of speaking on behalf of the Global Student Working Group, the Global Consensus Working Group, and the Expert Advisory Committee. But today's session will focus specifically and acknowledge the role of the Expert Advisory Committee in relation to that Global Delphi process that Catherine just mentioned, before delving into the actual process itself and the preliminary findings of where people prioritized student mental health research in post-secondary settings. So the reason why we wanted to acknowledge specifically the Expert Advisory Committee is because they were sort of the external governance group that oversaw the design and implementation of the Delphi process. And this group consisted of staff, students, and faculty from across 4 international universities. So the National Taiwan University, University of Toronto, King's College London, and the University of Sydney, where I'm currently situated currently. And just to give you an example of how the Expert Advisory Committee was involved throughout the Delphi process, before the actual surveys were circulated out to students, faculty, and staff, we had a discussion of how we can make the surveys not only accessible to those already working in the field, but to those students who might also have lived experience of accessing certain student mental health programs in post-secondary settings. And so the discussion of forming a video to explain what a Delphi process was tabled and discussed amongst this group to ensure that we improve engagement essentially with students who we were circulating the surveys out to as well. And so we just wanted to acknowledge the time and expertise of those who contributed to the committee. So Yu Che, Professor Shelley Craig, Wilna Gracias, Dr. Taiwei Gu, Dr. Frank Garfino, Rosina Somani, and Professor Kai-Ping Grace Yao, with, of course, the leadership of Catherine, Kristen, Emma, Gloria, and so on. And I think the Expert Advisory Committee really fundamentally showcases and underpins sort of the overall aims of the Global Delphi Consensus project itself, which was really to foster and leverage some of those interdisciplinary research collaborations with the 4 international university partners that were enabled by the CANOT program that Kristen mentioned earlier, so that students, faculty, and staff can meaningfully engage with one another with the very joint and aligned goal that everyone wants to see student mental health and wellness improve through world-class research. And because we're talking about these different priorities being student, faculty, and staff, we also wanted to acknowledge the different perspectives that each group brings. And we wanted to not assume that everyone today in the audience comes with the same expertise and knowledge, and wanted to establish some sort of common language. So when we talk about the Delphi process, we wanted to very simply explain what we mean by this. And I don't know if gumball machines are extinct where you are, but I certainly grew up loving them. So if I can very simply explain the Delphi process using a gumball machine as an example, researchers might try to understand what the tastiest gumball flavor is. And to get a more holistic understanding of the tastiest flavor, researchers might want to understand from the perspectives of students, faculty, and staff, just like how the Global Consensus Project aimed to do with student mental health research priorities. However, when you circulate the survey out, students, faculty, and staff might say that the blue flavor is awful, but they might actually suggest new flavors or particularly emphasize the deliciousness of one specific flavor. And so this process is iterated until really we aim and move towards consensus amongst students, faculty, and staff. And this is the process that was implemented. And surveys were circulated across the University of Toronto, King's College London, National Taiwan University, and the University of Sydney to really understand where research priorities lied in student mental health research across these 4 research institutes.
So in terms of the actual Delphi process that we're talking about, as we've sort of alluded to, there's a long-term sort of plan in place to create the results that we're presenting today. So first of all, we created the Global Consensus Working Group that came together to identify initially the priorities, the research priorities around student mental health. And the key piece here is research priorities, because there's been a lot of discussion around there's other priorities around student mental health that may not have the same focus of research. And so one of the big things from the takeaways today is that we are focusing on these research priorities. So the Global Consensus Working Group identified a number of different priorities, target groups, audiences that we would need to focus on to identify top research priorities. We also conducted an environmental scan of the literature to identify again what was being produced in the literature around future directions around student mental health. So identified a number of priorities from the literature, both published and gray literature, as well as the advisory group, the consensus working group. And then we launched the expert advisory committee that you've heard about already, that were able to explore the priorities that we had proposed in terms of an initial stage. And through that process of back and forth around what are the research priorities that are coming through the literature, as well as identified through the Global Consensus Working Group that also involved faculty and staff and students from the various universities, what we then were able to do is create the initial survey. So the survey was launched and was shared with our groups of end users and target audiences across the universities. And people completed the survey and identified what priorities they felt were of priority for student mental health. And of course, then we were able to look at, as faculty, as staff, and as students, what were the priorities that were emerging around student mental health. So through that process, we then took the results of the first survey. We reviewed those results. We also asked in the first round to give us, if there were other priorities that were not identified in the current list, to identify other priorities that we may want to consider around student mental health. And we also asked for feedback on the priorities, so that if we were to end with this list of priorities, are they worded appropriately? Are they equitable? Are they inclusive of the various target groups and end users that we are facing? And so through that first review process, it also went back to the expert advisory committee to also explore the results. And then what happened was we sent out a second survey. So in the second survey, the language was modified based on the feedback that we received in the first round. Priorities that did not meet a threshold of being a priority were dropped, and other priorities that were identified through the first survey round were included in the second round survey. And so in the second round, the survey was then also completed by individuals. And then we came up with this final research priority list. So what we'll do now is describe what those priorities look like from the various stakeholders that we engaged with through this process. And what we'll do now is present to you those priorities. So the name priority and the number isn't meaningful in this context yet. We do have the priorities listed, and a full list of priorities can be accessed by us at any time if you're interested in what those 33 priorities that we ended up with in the surveys looked like. What I want to demonstrate from this slide here is that the students, staff, and faculty rated the priorities differently. And so what you can see here, the priorities are color-coded in a way where you can identify that the students, staff, and faculty all had similar priorities across some of them. And also there were some unique priorities identified by any one of these groups of individuals as well. And so what we can do now is just show you what those priorities look like. So from students, from the 4 institutions and colleagues, what the students identified as research priorities for student mental health are on the screen now. The number 1 priority identified by students was a need around research to evaluate the effectiveness of early detection and interventions on mental health and well-being concerns in post-secondary students. The second priority, assess the effectiveness of post-secondary student self-harm and suicide prevention. And the third priority, investigate a sense of belonging and identity for post-secondary students and associations with mental health and well-being. You can see here on this slide a number of other priorities. We are identifying the top 10 research priorities from each of the groups that we surveyed. So for staff, what we had as the first research priority identified by staff was to evaluate the effectiveness of a whole university approach to student mental health. The second research priority, to develop collaborative and multidisciplinary approaches to post-secondary student mental health and well-being. And the third research priority, to assess the effectiveness of post-secondary self-harm and suicide prevention. So you can see immediately that the students and the staff had some of the same top 3 priorities, and certainly many of the top 10 crossed across the different groups. However, the priorities that sort of sat at the forefront or at the very top of their list were unique. So from the students' perspective, it was around the intervention effectiveness, and for the staff perspective, it was the effectiveness of a whole university approach to student mental health. And the faculty who were surveyed identified also, similar to the staff, the effectiveness of the whole university approach as their first priority. The second priority, collaborative and multidisciplinary approaches to post-secondary student mental health and well-being. And the third priority for faculty included to evaluate campus staff and students' knowledge and training in mental health to develop evidence-informed programming to address knowledge gaps. There were additional, as you can see here, across the 10 priorities. Interestingly, faculty were the only group to identify, for example, in their top 10, investigate the unique needs of international post-secondary students, for example. And there were a number of other uniquenesses. In particular, if you look across the different priorities, the students seem to be focused quite a bit on belongingness and loneliness and the sense of connectedness. The faculty and staff around this whole university approach and collaborative efforts are certainly needed in the research sphere around student mental health. So these are summaries of the top 10 priorities that students, staff, and faculty identified for student mental health research.
Thanks, Catherine. And I find those results quite exciting. And if I can shed some light on why I'm excited from a student perspective. So what stood out to me in those slides is that students, faculty, and staff did have different priorities and differing opinions. But I think the narrative of really recognizing everyone as equal experts was done so beautifully in my experience. And I think the differences were actually celebrated, which creates opportunities to collaborate across disciplines and across borders, as we have done during the Delphi process. And so what I'm really looking forward to moving forward is taking the list of priorities so that research efforts can be improved, aligned with those international priorities, and being part of that advocacy process really to ensure that there is that student voice quite active in that process as well.
And from a faculty perspective, as one of the leaders of the Global Consensus Working Group and this Delphi process, what became clear through this process of developing these research priorities was a need to focus on intervention effectiveness that the students identified. I was wondering around this idea of whether there was I put on the slide here misinformed, but really a knowledge gap in terms of what is being done in the intervention space and where that knowledge is disseminated for students versus staff versus faculty in this space. And so it seemed clear that while the students felt that there was a need to focus on interventions and the effectiveness of these interventions, that staff and faculty, for example, felt that work was already being done, and that priority then fell a little bit lower on the top 10 priority list. So one question that arises for me is really in the space of as you know, what's next is to identify where the research is being disseminated and making sure that the knowledge is clearly accessible to all the groups that are involved around student mental health, so that we can better not only continue this area of research, but also be aware of the findings that do exist in this space. What also became clear from that list, I know we presented the list fairly quickly, all things told, but the whole university approach to student mental health came through as a research priority across all different groups. And the multidisciplinary collaborations appeared to be quite important for research. So building capacity around research that ties in both the whole university approach as well as multidisciplinary collaborations within our campuses, as well as external to the campuses and in the 4 institutions that we have on this team, as well as even broader than that, to identify ways in which we can connect and collaborate around this really important research agenda. As I mentioned when I was presenting the priorities for students in particular, but across the staff and faculty as well, this idea of belongingness and loneliness came through as a research priority, and understanding more about belongingness and loneliness. One of the takeaways from this priority in particular is to explore how belongingness and loneliness are captured and measured and explored, not only within counseling, but within classrooms and within the whole university approach. Again, bringing that together and exploring ways in which we can better measure and assess these concepts. So exploring belongingness, loneliness, and this supportive social connectedness pieces within the campus climate. We know that it's a really important piece in this in the relationship to student mental health. Also, what came through was that we need to focus research on self-harm and suicide prevention strategies. So these were quite high on the priorities across students, staff, and faculty, and as such need to be the critical research efforts where we start to move in this space. And finally, the final result, I guess, of this work really suggests that we need to focus research actions are needed. We need to explore, funding for student mental health that can start to address these research priorities. These priorities can be used as a framework for all of us as researchers and practitioners to build our next steps and become sort of that foundation for funding protocols, for collaboration, which again is also part of the priorities themselves, and advocacy work around student mental health. And these become very clear across the globe, when we look at these research findings. So important for next steps. And when we finish our presentation here today, one of the requests, I guess, that we have as presenters today is to start thinking about how do we address the priorities that we've presented today, so that we can best facilitate the research and in student mental health specifically. So the next steps for us as a group, there's just a few new or recent activities that will be done. First of all, in June, so coming up soon, there's a Student Mental Health Summer Research Institute that's happening in Toronto. Students will be flying in from all over the globe to participate in this Summer Research Institute. And as part of that Summer Research Institute, these findings will again be presented and navigated to identify ways in which we can now again address the priorities. In August, there's a presentation at a conference, the Collaborations for Change conference, that will also allow us to present the findings from this work and establish action items. In coming, to be announced, I guess, in 2024 or over the next year, we will have a global research exchange that involves addressing some of these priorities and creative ways to start to explore the priorities that have been identified. And of course, ongoing from now onwards is, collaborative publications and student-driven e-modules to help train students and support students in this space. Recognizing again that the expert advisory group, that the Global Consensus Working Group, and that the student working group are all aligned and coming together to produce the most that we can from this work so that we can become that foundation for research priorities in student mental health.